Okay, Kailin, shall we start? All right. Assalamualaikum and a very good day, everyone. My name is Faisal Zulhumadi. I shall be your MC for today. Welcome to our program, the International Bootcamp webinar series with the theme Safety Management and Disaster Reduction during the COVID-19 pandemic. For your information, this is the second session in a series of webinars brought to you by the Asian Cooperative Program, as organized by the Disaster Management Institute, or DMI, under the School of Technology Management and Logistics in University Utara Malaysia. This program is also in collaboration with Kansai University of International Studies in Japan, as well as Universitas Gajah Mada in Indonesia. So I would like to give you a real warm welcome to all our representatives from these respective universities. Thank you for attending our session for today. So for today, we bring to you three prominent speakers in their respective fields. We have Dr. Khamarrul Azhari Razak from University Technology Malaysia, or UTM, Sharima Ruwaida Abbas from University Utara Malaysia, who is also a co-volunteer of Mercy Malaysia. And last but not least, Mr. Hafiz Amirrol from Mercy Malaysia. Now, please let me remind you to mute your microphones during the presentations. And you are welcome to type your questions in the chat, and we will get around to answering them after the speakers have completed their talks. So I hope everyone can give their full attention to all these speakers. So without further ado, let me please introduce our first speaker that has been slotted for today, who is Dr. Khamarrul Azhari Razak. For your information, our first speaker is also involved in the meeting today. So we are very, very thankful and grateful that he can spend the time to be with us to give his presentation. Okay, so Dr. Khamarrul is currently the Director of Disaster Preparedness and Prevention Center, or DPPC, under Malaysia Japan International Institute of Technology, which is associated at University Technology Malaysia. Dr. Khamarrul obtained his PhD in remote sensing, LIDAR Geosciences, Geomorphology and Landslides under Faculty of Geosciences in Utrecht University. Now, he has a lot of experience in surveying, in the Department of Surveying, in Ministry of Natural Resources and Environment, and all sorts of organizations. He's also a visiting research scholar for Disaster Prevention Research Institute in Kyoto University, International Research Institute Disaster Science in Tohoku University, as well as ASEAN Disaster Reduction Center in Kobe, Japan. His expertise and interests are in geohazards, disaster risk reduction, multi-hazard risk assessment, and various other fields that he is basically interested in. And he has done a lot of research, consultant projects from 2015 onwards, which involved work with the ministry, with various NGOs or non-government organizations and whatnot. He has a lot of publications related to his projects and consultations. And also he has been involved in community projects such as Disaster Risk Reduction Program in Sabah, in Kundasang Ranau, and has been program directors for various programs. So is our first speaker ready?
Yes.
Yes, okay. Without further ado, I would like to invite Dr. Khamarrul to give your presentation. Thank you very much, sir.
Thank you very much. It's my great pleasure. Let me share my screen first. Whether we see in the screen. Can you see my screen? Just want to check first. Anyone?
Yes, we can.
Yes, we can see it.
Okay, good, perfect. And I have about 18 minutes presentation and followed with some quick Q&A session. Thank you, Mr. Chairman, It's my honor to be here virtually, and thank you, UUM, for the invitations. Assalamualaikum and very good afternoon, everyone. Konnichiwa. Thank you for joining my session organized by Disaster Management Institute. Well, for today's session, I would like to bring two topic, climate-induced disaster and COVID-19 pandemic. I think you are aware of these two issues. And what we are interested in today, perhaps to share some of the untold story and lesson. So it was, I think, based on my recent expedition and rapid assessments to some of the states that are suffered by the monsoon in January this year. So welcome to all participants of ASEAN Cooperative Programs International Bootcamps webinar. And my name is Khamarrul Azhari Razak. I've been working with UTM about 16 years, and I'm currently a director of Disaster Preparedness and Prevention Center of Malaysia, Japan International Institute of Technology of UTM. So to get a start, I think let's bring some fact and figure. I think on the left you see there's a worldwide cases, those people who are recovered, and also human losses. Yeah, so you can see on the right side is a Malaysian cases. We are talking about 337, more than 300,000 people actually are suffering or at least get a positive to this one of the biological hazard recognized by United Nations Office for Disaster Risk Reductions. So what I'm going to do, at least today, how we can see this crisis, this type of disaster as part of looking forward to the future opportunities. So by giving that context, I'm talking today on 4 outline. First, I will be giving some scenarios. We are facing with 300,000 people got affected in Malaysia. The meantime, we are also suffering by the monsoon, by flooding, by landslide, and some other climate disaster related induced event. So say from the ASEAN perspective to Malaysian context, how we can bring the concept of transdisciplinary approach and how we can mainstream some of the disaster risk reductions and resilience strategies. So like it or not, I think all of us are here today. I think our governments have committed to Sendai Framework for Disaster Risk Reductions 2015-2030. I think we are talking about less than 10 years to commit to fulfill some of the targets set. So I hope that through my speech today, I share some of the untold story, lesson learned, some recommendation. I will end up with some recommendation and secret recipe. So a couple of minutes about my center. We established back in 2015. We born similar year with National Disaster Management Agency NADMA under Prime Minister Office. We collaborated with Japanese partners, research institutes, universities in Japan. So we bring some of the Japanese style education engineering solutions into the perspective of disaster risk reduction and climate change. So if you see that DPPC, in short, Disaster Preparedness and Prevention Center, have 5 focus area. So today I will be picking up some of the issues, challenges, directions, barriers, put it in the context of proper solutions. And as I mentioned, we have less than 10 years to fulfill a Sendai framework. And I think last 2 weeks, Sendai and Tohoku has celebrated or at least commemorate the 10 years earthquake and tsunami in Japan, which caused more than 20,000 people life. So I hope that we can foster inclusivity, empower local actors, local champion, and promotes, of course, science and technology, and towards strengthening our societal resilience. So come back to our topic, what we seen pandemic, one of the type of biological hazard. how do we prepare for the big one, for the future pandemic, for example? It can be in the different contexts of COVID-19's coronavirus, but it's much more severe per se, or the impact is much more higher than what we face at the moment. So this possibility is still there, and how we actually prepared to face such a worst case scenario. So come back to a couple of slides just to give you some sort of idea where we are. So this pandemic, I think, is so-called hybrid induced. There's always a man-made and natural induced, but of course we would like to see the complexity and interactions of human, economic, and political system. So that's why, in some sense, we see the way we see risk, disaster risk last 20, 15 years ago might be different for the next couple of years to go. So that's time for us to see, to reflect, to rejuvenate our strategies. Let's bring you some facts and figures. Last year, UNDRR, United Nations Office for Disaster Risk Reduction, has released, you see the impact, the numbers of human losses, economic losses. And the interesting remarks by United Nations Office is about the inability to understand and manage systematic risk. So that's something that we have to highlight today in my session, and perhaps in your discussion in your international bootcamp, how actually we manage, understand the complexity of systematic risk, one risk that can trigger another risk. The impact from one may affect another set of a process, for example, and you see from one event it may trigger another event, and the impact, the size as well. So let's put it in the context of our commitments, our governments, those in Japan, those in Indonesia. So I think all the governments in this world at least put some commitments in back in 2015. So we are talking about the next 10 years to go. We have to fulfill 38 Sendai indicator, and you can see the Sendai Monitor website that many countries actually are behind the schedule, and of course Malaysia is one of them. And I think today is also a good time for us to reflect, to review what would be our strategies. And before we hit with this coronavirus COVID-19 in Malaysia, there was a figure issued by the Ministry of Economic Affairs at that particular time, and now known as EPU, about well-being index. And you see health is among the highest well-being index compared the last, in 2010 until 2017, it shows some dramatic figure. At least it put aware of some issues and challenges to face our public health institutions. But of course, a year after, we have noticed that this pandemic, or at least pandemic, came into the pictures. And put it in the context of from climate change, impact of our climate change. You see there was a report released by AHA Center showing about the percentage of population exposed to flooding, and Malaysia, at least within this context of this report, should aware of the potential future populations in ASEAN. I'm perhaps I will be skipping some of the slides, but at least you can see, you can get this slide from the organizer. So there was last year, AMA reports also released the Global Climate Risk Index. So both countries, all the countries are showing, projecting the achievements and looking back some of the performance. So put it in the context of Malaysia, I think we have noticed some of the figures, some of the statistic that shows the number of urbanization rates, the projected climate induced perhaps may make it things worse in the future. So, perhaps this figure would be improved, would be added with some new investment by the Malaysian governments. At least put it in the context of last year, on 29 October of 2019, it shows that the economic losses of Malaysia based on 10 years records that supply to based on the Sendai framework more than 400%. And coming back to this systematic risk, I think it's a perfect time for us. And I will be sharing some of the stories from the field. I was in the mission, and we hope that we can see some of the figure. But before that, I wish that I can promote this concept. You can have a look. There was a couple of papers about transdisciplinary approach. It's an approach to achieve a common societal goal. It was, I think, promoted by the Japanese 13 years ago, and we would like to implement. We did a couple of years back, but we see these great context, great concepts and principles to translate the complexity. So all of us today, I think, perhaps coming from different background, different expertise, interests, and demand. So what we are looking from one side might be different from the other side. So that's how the transdisciplinary approach come into the picture, and how we can co-design, co-produce, co-deliver, and co-implement some of the activities, and perhaps the scientific knowledge-based decision-making concept can be translated into action. So from moving from single, multi, inter to transdisciplinary, there are some rules, some regulation, principles, characteristic. I'm happy to share some of the concept in this short presentation, but let's see some of the example. It's a Kota Balut district. It's located in Sabah. A couple of years back, they faced 86 times of flooding in this region. You see, there is a mountain. It's the highest mountain in Malaysia. It's Mount Kinabalu. It's a World Heritage Site. It's our first UNESCO World Heritage Site. And they are suffering. They are suffering from not only the climates, from the rockfall, debris flow, flooding, mud flow. During the wet season and during the dry season, they face drought. And it's a rice bowl of Sabah, 10,000 hectare of rice, of paddy plantation that translate into these food insecurities issues. So I hope that I can bring this example later on, and how actually we see the same community, the same cities are facing a pandemic cases, you know, from one week to another. And perhaps you know the story of political the politics in Sabah, and it bring another cluster as a result of the state election. And a couple of slides before I move to the quickly. I'm running out of time. This is a new guideline. I was part of the national consultant preparing the national guideline, and it's so-called disaster resilient city. There are 125 indicators. You can see how we actually develop, and it's a public documents, and we covered a different context, 6 different disaster type, covering based on the pilot study in 12 major cities. So we develop and how we can inject some of the concepts at the national, state, district, and local level into these risk-informed resilience concept. Let me quickly move to some of the local experience. Moving for more than 1,800 kilometers of traveling last December and this year January. So I just picked it up the second mission on rapid assessments. Is very interesting to see how actually we met several contacts, stakeholders from the district to the state disaster management committee, and we understand the needs and demand. What I'm interested to share, that out of 60,000 people displaced out of this monsoon season this year, and none of them are actually affected in the evacuation center. So can you imagine that Johor and Pahang have been severely affected by flooding, and 40 to 60,000 people are displaced from their homes, and they stay in the temporary evacuation center. But interesting remarks that some of the policy that released by the National Disaster Management Agency and National Security Council, KKM, Ministry of Health, for example. So it works. How actually policy translated into actions, how does the words translated into practice. So this is something that I observe, and we met several stakeholders at the state, at the district. One of the site that we met in Sungai Kahang, one of the severe affected area in Keluang, Johor, and we visited area. Unbelievable to see all the damage. At the same time, they have to maintain the SOP. They have to make sure that the transmission of the COVID-19s are at the lowest part. So we went to the site, we helped the people, we speak and we understand, we listen some of the experience. It's not an easy process, but I think at least for this particular part, we should congrats our frontliner who keep the transmission zero in the temporary evacuation center. And we also met some people who are suffered, who are underprivileged, like a deaf, disabled person. It's not easy to communicate. There are many lessons learned from this, and perhaps the communication release, the warning sent by the governments cannot be understood by a certain group. So you see there are some gaps, some still. And this guy, Mr. Sharaf, we met them in Pekan, one of the most severe region in the state of Pahang. It's basically in the downstream of the Sungai Pahang. You can see every year they face a flood, but throughout the crisis, throughout the difficulty, there is a new opportunity. They use new equipments, they build a local organization, they strengthen the local network, they helps back the society, So it's amazing to see these groups are actually helping the governments, that everyone in the state of Pahang, or at least in the Pekan district, are suffering, but there's a small groups are helping the community. So these are amazing. You can go and visit them, and we met many people in the field, listen the stories, and of course these untold stories you can't really find in the journal, in the articles. You can't really so-called reflect some of the experience if you come to the area 2 years after, for example. So let's put it the context of lesson learned. So infodemic, I'm pretty sure that we can discuss this. There are many issues, challenges that we face, but something that I get it from the field is about infodemic, how actually the real truth data transmitted to the local vulnerable people. And we built the concept. We look into how we can improve our policies, at least at the local levels, how we, from the resilience to the health emergency risk management perspective, and see how the data management, technical assessment can help the decision makers. So I hope that I can talk even more about these slides, but I'm running out of time. But interesting part, we have developed the framework. We use some of the international framework and put it and downscaling at the local level. And coming back to a couple of slides before I end, talking about the decision-making process, not easy as you imagine. To have a compound disaster, one climate-induced disaster with COVID-19 is not an easy process to handle. But of course, data, information, knowledge, communication, and the decision-making process might be interesting to explore. And put it in the context of our roles and responsibility, at least within the context of my roles as an academician, as a scientist. I think everyone should play a role, and we have to understand the needs and demand from the other side. So that's how we actually can co-design some of the programs, produce some of the activities, so that it can increase the the achievements or the level of productions. So I may end up with 3 recommendation and secret recipe. I think some of them has been mentioned, how we use this transdisciplinary approach and make use the technology. Science-based data can help decision-making process, how we actually use empowering local actors, local champion to execute some of the high impact project, program, and activity in the future. And number 3, the political wills and commitments. You know, political leaders' commitments is also play a major role. And we are talking about the time that I took these photos. It's already 50,000 people displaced from their home, and unbelievable to imagine that the COVID-19 pandemic in some states are increasing, and we managed to reduce the transmission at least during the COVID-19 season. And on my last note, sustainable development cannot be achieved unless disaster risk is reduced. So I think with that, I close this session. Thank you very much. Assalamualaikum and have a great day.
Waalaikumsalam.
Waalaikumsalam. Thank you so much. Dr.
Waalaikumsalam.
Khamarrul. Thank you, Dr. Khamarrul, for your talk. That was very enlightening, actually, regarding disaster risk management, with the index, with the untold stories, actually, that does not see the light of day. And for your recommendations, that's pretty, yeah, it needs an overall work from everyone, all the stakeholders, all the people involved and whatnot. Well, basically, there are several questions, but we are saving it for later, as we need to press on for the next speaker so that we can actually end up completing this session today on time. So, if you'll allow me, I would like to introduce the next speaker. Okay. Next, we have Sharima Ruwaida Abbas, who is a lecturer at the Department of Psychology and Social Work, School of Social Development in University Utara Malaysia. Sharima obtained her Bachelor of Social Work and Master of Social Work from Western Michigan University in the States, United States of America. She is very active in social work and also volunteer and disaster missions, and she has obtained various certifications through various training programs, such as graduate certification specialization in nonprofit organization from Western Michigan University, disaster management certificate from Asian Disaster Preparedness Center, and certificate of psychological first aid in practice, helping people cope during disasters and public health emergencies, training of trainers in Hawaii. So without further ado, I would like to welcome Ms. Sharima to present her talk for today. Is she ready? Or as I understand it, we have a video of her presentation.
Sensei actually prepare a recorded lecture.
Yeah, she has the recorded lecture, yes.
I will help host to share the recorded lectures to the participants.
Okay, will we be seeing it live here today? Now?
Yes, I will sharing.
Okay.
Hi, good afternoon, everyone. I'm glad to be here, part of this International Bootcamp webinar series number 2. Our theme for this time is actually safety management and disaster risk reduction during COVID-19 pandemic. And this is another series of ASEAN Cooperation Program. It's a collaboration between University Utara Malaysia Disaster Management Institute, with Kansai University of International Studies in Japan, and also Universitas Gadjah Mada, Indonesia. So my focus is going to be, what I'm going to be sharing today is on mental health and psychosocial support in Malaysia during COVID-19. So allow me to share my slide. A little bit background on myself. I'm actually a social work senior lecturer from School of Applied Psychology, Social Work and Policy here in University Utara, Malaysia. I'm also part of UUM Disaster Management Institute, and I'm a core volunteer for Mercy Malaysia. So, I mean, if I believe many of you knows what Mercy Malaysia is. It's one organization in Malaysia that well known and focusing on disaster management work. Just a little bit of scenario of what exactly happened in Malaysia in terms of psychosocial condition during pandemic COVID-19. Malaysia started the first MCO, Movement Control Order, in March 2020, last year. So when the government started, restrict movement order for many of us, many of the Malaysian. So there's a lot of psychosocial conditions actually affected. One of it is job security and employment. We see there's an increase of people actually losing their job, and they're not able to actually conduct their businesses, especially those small businesses, that they are actually losing a lot of financial income, their normal financial income, due to the fact that they cannot open up their businesses during that time. And then, most of us are actually asked to work from home. And this is the first time for Malaysia actually, work from home for many of us. So there's a lot of adjustment scenarios here, okay? When people work at home, they also have to manage their household at the same time. So just imagine, like, for a person who has family members, so they have to manage their maybe their children at the same time, their kids at the same time, or if there are there's other elderly members in their home, so they also have to manage that. But at the same time, there's demand and requirement from their job that they need to actually complete and do the task, as soon as possible. So with these situations, they actually are forced to do double work at the same time. So basically, they need to actually learn to adjust in terms of managing their skill, doing multiple works at the same time, and also time management here. A lot of people, when they started doing the work from home, is a very stressful situation for many of them, because it's not easy. Like I said just now, it's not easy while you have to manage several things at one time. And with MCO also, and with this pandemic COVID-19, so we all now in the new normal expectation. There's a new normal way of style of living and things like that. It's a new normal. So when we talk about new normal here, there's a lot of new adaptations that we need to actually adapt. So sometimes people are having difficulty, I'm taking times to do the adjustment, to do this adaptation. In new normal, everything is physically distancing. You also need to observe, your you need to wear masks and those kind of things. So very minimal face-to-face meeting. So mostly it's actually online communication. So it required a lot of time spending, on online and things like that. So sometimes, in terms of housewives also is, it's demand a lot of time to actually look on the computers, on the screen and things like that. So this is actually affected also in terms of health situation, yeah, and also emotional impact, because it's not easy actually communicating online, especially when you communicating through WhatsApp and things like that, because sometimes the tone of reading may not be the same. So if the tone of reading may not be the same, there might be easily miscommunication can happen there. So emotionally, it can be actually affected for those who actually, having difficulty understanding each other through online communication. Also, with the online communication, sometimes, when we started with that, a lot of people are not, we all not ready for that. Yeah, we are not ready. So there's a lot of demands in terms of you need a new gadget, you need a new technical thing and so whatnot. And this has been giving some pressure, and also a demand in terms of financial needs, yeah, to many of the people who are affected through this pandemic COVID-19. In terms of education, yeah, sometimes at first, there are like the school schedule are not actually in place well. When we felt like the numbers of cases are kind of reduced. So the ministry decided that the student needs to go back to school. But when it's in plug at the same time, when they go back to school, and it decided to actually go back to the online distant learning. And it's not easy for the children to do online distant learning, especially when they are staying in a remote area, very difficult to access to Wi-Fi and so whatnot, to data and so whatnot. So this situation also has, contribute a lot of anxiety, a lot of unhappiness among children and also the parents, because the parents now is the teachers at home, so they have to manage their emotional well-being, they have to manage their time in order they be able to actually assist their kids at home. So all this situation is actually giving because of this pandemic COVID-19, yeah, a lot of psychosocial conditions is actually affected. Okay. So in health situation, when we look at in the what actually happened, our mental health condition during a disaster. Normally, when any kind of pandemics or outbreak, any kind of disaster or crisis, psychological burden can be in place. Okay, it's easy to felt like we kind of having some stress, or perhaps maybe other anxiety level. So all these things can actually inflict psychological burdens. Aftermath. Okay, let's see, for a person who already got affected by convicts, for example. So aftermath is actually a lot of major life changes. In fact, all of us are having major life changes here due to new normal what do you call it, a new normal style of living right now. Okay, so major life changes and uncertainty about future life after the disaster. So this is something that people are thinking, what exactly is going to happen to them. So all these things actually happen to all of us here. Okay, So basically, psychosocial trauma can be also causes social and lifestyle stress because everything changes, and there are needs that you need to actually, maybe some kind of a demand from this new lifestyle. Psychological trauma affected, yeah, and there's a lot loss, anger, grief, and guilt actually involved with this, with the mental health situation in disaster. Okay, so let's look at when we talk about how COVID-19 affected the community. When we talk about the patient here, yeah, patients easily separated from their loved ones due to illness or death. We now in Malaysia, the death toll is more than 1,000 already. Yeah, so when someone got COVID-19, they have to be isolated. So, isolation is not that easy for some people, because perhaps the person is the one that actually runs that actually assists a daily task for the family members. So not just the COVID-19 patients affected by this emotional condition, but also their loved ones, their loved one also, because they can't communicate and things like that. In fact, when someone die from COVID-19, not all family members can actually go and observe, and pay their last respect towards the person who who already passed away. So this is a thing that it can easily affect communities in terms of emotional well-being due to this COVID-19. Our frontliners, especially our health workers, our police, our those who department welfare officers, yeah, those who actually are the frontliners, they need to deal with high workload and also a lot of stress, especially when they have to expose to long hours of working, because the cases keep arising. So they have to they have to actually serve this to their client and patient, yeah. So it's just so this, they themselves also facing a dangerous situation in terms of well-being, in terms of their own health. They may not get enough sleep, they can easily get emotionally affected, yeah, and due to and this can be a life threatening as well, and because of with a lot of demand, sometimes there's needs a lot of coordination between agencies, between right information for people who actually needs to understand what the situation is. Yeah, so this is also can also contribute, to emotional not to say dissatisfaction, but the emotional affected. It could be something that they are worried for, that they are not happy. Yeah, so that's the situation is. Students, obviously, especially what I'm student here, especially university student. Reason why when university student, when this thing happened in Malaysia during the MCO, the first MCO back in 2020 last year, March 2020 last year. So many of the students actually, they are still on campus. Some actually on back home during the break. Yeah, so so they are the one of the groups actually was affected, because they can't travel, those who stay on campus. So we had to do a special sending back the student back home following the procedures, the standard of, there's the SOP that you need to what you need to observe. Yeah, so there's a lot of conditions that and definitely because of that, now most of the teaching in the university actually online, and we are still using online learning here. Yeah, so distant online learning education or online distant learning is not easy for everyone. Some of the students having difficulty with the data system, with the line at home. They have to now buy their own data. So not many students coming from a well-do family to consume that kind of, to buy that kind of data. So this has been directly infected for this group of students. Okay. Those associated with COVID-19, any of us, yeah, can be vulnerable to social stigma, especially those who, like sometimes, you hear that, oh, their father has already a positive patient of COVID-19, right? So all of the family members kind of affected because of that, because they could be affected from the father and things like that. So basically those associated with COVID-19 can be vulnerable to social stigma, worsening their distress and isolation. Okay, so basically with all this situation, yeah, experience in what range of reaction, and it easily people become fearful, yeah, because of the condition of COVID-19. Just now people become confused because there's no enough information. They don't understand, like, okay, how far you need to be for you not getting COVID-19, what kind of mask that you need to wear, this kind of thing. People can be confused because they might not get enough information about that. And there's a lot of information sometimes can be overwhelmed as well, yeah. And people become anxious on certain things, and it's very easy to be detached. And also sometimes people just kind of feel numb, because they don't want to kind of know what exactly happened, So these, things that can actually affect our community due to COVID-19. Okay. So a little bit on what exactly Malaysia is actually doing on mental health and psychosocial support during COVID-19. So we actually look into a different aspect here. What I'm going to be sharing here in terms of one, you could actually see it's coming from our government. So our government and Ministry of Health mobilized MHPSS team at state, yeah, district levels, and all also and all hospital. So MHPSS team is actually those already been trained, in terms of giving support in mental health and psychosocial support. Okay. So MOH coordinated and collaborated with a lot of NGOs, including Mercy Malaysia. Non-governmental organization, for example, like Mercy Malaysia, and quite a number of non-governmental organization, they also established their own HPSS team based on where they actually located, and they also serving their local community. So basically, throughout Malaysia, there are NGOs providing HPSS for the local community. Okay, but a lot of these NGO can be reached out everywhere because they also provided hotlines. So I'll be sharing that afterwards, yeah, and other services as well. And in the university, most of the university they also provide a different kind of psychosocial support and also mental health support. through student departments and also counseling center. So basically, mental health and psychosocial support team consists of psychologists, social workers, counselors, medical officers, trained volunteers in in psychology and psychosocial aspect. So that's how Malaysia, provide all the mental health and psychosocial support through a different areas and different NGO. And when I talk about government, it's also happened in a federal level and also state level. Okay. A little bit of what mental health psychosocial support activities provided here in Malaysia. One of it is psychosocial support hotlines, online one-to-one counseling, and through a psychotherapy session, online psychological first aid PFA training, university psychosocial support group. There's also a parent focused training, because especially with the special needs, they need a special training for the parents on how to provide care during MCO, during the stay at home kind of situation. And caregiver for geriatric training, especially elderly groups. They are also a vulnerable population that cannot move a lot. So through this MHPSS program, so we are training people to give a caregiver, to become a caregivers for this elderly group. Okay, and also mental health and well-being workshops. So a lot of mental health well-being workshop as it should be done in different level, different state, different NGO members, different organization, and so whatnot. Okay. And then adolescents resilient and well-being workshop, and also webinar, Facebook and live session. So a little bit of psychosocial support. Ministry of Health actually collaborated, with Mercy Malaysia to come up with psychosocial hotline support. So this hotline support was actually given from 8 to 5 p.m. at that time, and it's every day, daily. And I was part of this, one of the responder to answer the hotline for this psychosocial support hotline. We also have different organizations, different NGOs also providing psychosocial support. For instance, normally this Talian Kasih under Department of Social Welfare, they already have this hotline hotline psychosocial support, but due to this COVID-19, they actually extended the services from this Talian Kasih under Department of Social Welfare. And it's the same with a Women X organization that focusing on domestic violence. Is actually there's an increase of number during this movement control order. Cases like domestic violence, child abuse, Women's AIDS organizations is actually the organization that focusing on this, and they also extended their hours during this pandemic. Okay, and they actually provided a 24 hours WhatsApp that calls Tina. Tina means thinks I need help. So this is a code number actually, Tina. All right. So so this is actually ways that our government and also NGOs try to provide any kind of emotional support, psychosocial support through all this hotline. And definitely the Ministry of Health actually established the 24 hours crisis preparedness and response center as well. So any kind of inquiry or concern or related to COVID-19, they can actually call 24 hours crisis preparedness and response center. One of the things that we understand and we acknowledge the demand of work that frontliner has to do. So Mercy Malaysia, in collaboration with others, stakeholders that actually contribute to this donations so that they be able to actually provide a free 5 session to if any of the frontliners needs assistance in terms of emotional support or any kind of psychosocial support, right? So so this is actually a free services given to all the frontliners, And for those who actually in quarantine center, Ministry of Health actually provided, MHPSS for them. So basically, if we look at the distribution of these services is everywhere. It's all over. It's just that the community needs to know where to reach out. So with the helps of advertisement, words to word. Friends probably knows about these services and so whatnot. Yeah, so they can the community themselves can actually get all these services available to them. Another one is psychological first aid. Yeah, a lot of psychological first aid actually been done from government's department and also from the different NGOs. What I'm sharing here is the Mercy Malaysia one, yeah, because I was part of this as well. So basically, we provided psychological first aid. So what exactly is psychological first aid? So a very simple way to understand, yeah. If you kind of get hurt, so you'll be giving the first aid, right? So this is like initial helping so that it will reduce the risk of getting worse. So is this the same with psychological first aid? Yeah. So we providing assistance to support emotional help so that it's reduce the risk is getting worse emotionally. All right. So there's a general psychological first aid that we provide to all helpers during COVID-19. Anyone can actually attend this program. And there's a special one for those who are actually working with children, child PFA training. Okay, so the aim of this program is actually to acquire skill and knowledge of PFA and competence in practicing it. So everyone, those who are in help, being exposed and to client, to anyone that they actually help, it's good to actually learn psychological first aid because it's actually help us to understand ways to communicate to people in distress, to people with, in probably in the anger mood or something like that. So that's very important, because psychological first aid is actually focusing on on listening and also observing on what the needs are, and you actually link to whatever the necessary or resources available for this person condition. Yeah. So with the hope that people who actually go this under psychological first aid are able to actually apply during during mission and work. At the university level, I'm just pick a few, but at the university levels, all universities actually provide psychosocial support. Here in our school as well, School of Applied Psychology, Social Work and Policy also providing this psychosocial support during COVID-19. Yeah, so we have numbers of faculty members that take duties different days, yeah, there's a phone that the community in university and also outside university can call us. It's same also with counseling center in University of Utara Malaysia as well. They also have visual support groups and other mode of assisting people in the community as well. And other universities as well, has a different kind of support group, and they're not just providing that this support group to the university to the university community, but they actually extended that to a nearby community as well. So this is actually very helpful because the community can easily accessible this kind of services, and all these kind of services is actually free, so the community can actually access easily. Others programs that falls under mental health psychosocial support. I'm giving a few examples from Malaysia. They are focusing some workshop on caregiver for geriatric training, and there are also a lot of webinars, a Facebook Live, sharing session on violence against women and children, for example, and how these situations needs to be tackled during this COVID-19. And there's also a sharing session on different kind of mental health situation and trainings and so whatnot. So this actually happens, most of it is actually online. So when it's online, everyone can actually accessible, from everywhere, from everywhere in Malaysia. I believe that's all my sharing session today. Just a little bit of what Malaysia is actually doing in terms of reducing the risk of emotional affected from COVID-19. So we also have a hashtag that called Kita Jaga Kita, means we take care of each other. Yeah. So this hashtag actually giving some kind of inspirations and also a commitment for everyone to take care of each other. All right. Okay. Terima kasih. Arigato. Thank you very much. If you have questions or anything, you can also email me, at sharima@uum.edu.my. All right.
Okay, thank you, Sharima, for such an informative and enlightening presentation just now. Loaded with information, and I think I went through the COVID-19 pandemic initially with it was such a heavy change on my mindset, and mentally I think it kind of affected me, whereby there was a lot of things that changed and whatnot. So thank you so much for that sharing session. So for our final speaker for today, allow me to introduce Mr. Hafiz Amirrol. He has worked in various humanitarian situations on the front lines and back ends, where people encounter hostile forces in disasters and conflicts. So you can imagine the experiences, the situations that he has been in. And Hafiz is the managing director of Humanitarian Capital, a transdisciplinary consulting firm specializing in the humanitarian and development sector, strategic planning, risk communication, and also community engagement. Currently, Hafiz is consultant for Mercy Malaysia, UN Habitat, the Japan International Cooperation Agency, and Yayasan Sejahtera. He is also the research advisor for Asian Disaster Reduction and Response Network, or ADRNN. He studied architecture at University Technology Mara in Malaysia, in the field of in Architectural Association School of Architecture, London, and also Institute of Technology Bandung, Indonesia. Hafiz teaches urban design theory at UITM, University of Technology, Mara in Malaysia. So I would like to ask, is Mr. Hafiz ready for your for his presentation?
Assalamualaikum. Thank you. I'm ready.
Waalaikumsalam. Okay, over to you, Mr. Hafiz.
Thank you very much, Mr. Faisal. So let me share my screen. And can someone confirm that you can see my screen? Okay.
Yes, yes, loud and clear.
All right. Thank you very much, everyone. So, and thank you for the introduction. I was requested to speak something about disaster risk reduction and management and a bit on resilience. And then when I saw Dr. Khamarrul's name on the list, I said he will cover most of them. So I missed Dr. Khamarrul's session just now, but I'm assuming that he has covered all the basic principle, all the basic issues and challenges with regards to disaster risk reduction and management. So what I will do is to take one small portion, which is not new, but maybe new for someone, but I'm sure it is not well applied worldwide. But I'm sure Japan has some advancement comparing to us here. So it is on how smart technologies can help reduce the risk of COVID-19 and improve community resilience. Okay. So first of all, just a little bit on, we need to understand what is disaster and what are the threats and hazards that leads to a disaster. Perhaps Dr. Khamarrul has covered this before as well, but in a nutshell, we can classify things that will lead to disaster if not managed properly as human-made or are caused by natural hazards or are hybrid in nature. Yep. Maybe we are quite familiar with human-made led disaster such as geopolitical volatility. I mean, the world, some parts of the world are still at war. Yeah, cyber fragility, maybe that's something new, terrorism and so on. Excuse me. And perhaps we are also familiar with natural hazards like volcano, tsunami, earthquake, and so on. And even the hybrid type of threats and hazards are not alien to us, but this is of a particular interest because what the world is experiencing nowadays, pandemic, can be classified as a hybrid threat and hazard that is disrupting our daily life and operations of almost everything. So in a nutshell, that's about threats and hazards. And we also need to understand this terminology, which are part of what makes a disaster. The factor of vulnerability, the factor of exposure, and threats. When they interact together and when they are not managed properly, they will create risk, which will eventually lead to crisis or disaster. Almost everyone, each individual, every community, or every places in the world have these three elements, but they are not necessarily be viewed as something that is negative. Yeah, everyone, every community, every places, they have their own capacity level. What type of capacity? Those are the things that we need to be aware of, or self-aware, be self-aware. And at the same time, we should understand and aware of the level of vulnerability of our own self, of our own community, of our own places. Similarly, being aware and to have some level of understanding on what are the exposure that we are exposed to, because those exposure, which are mainly caused by the threats surrounding us, will lead to multiple possibilities. And when I say multiple possibilities, it can be generally classified into two. While mainly people will see it from the negative side, the risk factor, but do not forget that in any situation, there's always opportunities to rebuild something better, the opportunities to bounce back into becoming more resilient. There are benefits of any situation, yeah. And Sharima was talking about mental health, so well-being can be improved. So those are the positive side of the possibilities that are caused by by the situation of being exposed or or experiencing disaster. And from those two opportunities and risks, there are impacts. Again, impacts which are bad or good depends on how well we manage those disasters. So the key word here is, how do we manage disaster risk? Disaster threats, exposure, vulnerability, and capacity, they are almost natural. They are always there. And how human, with the help of specific tools, with the help of some technology or governance or support, can shift the impact from bad to good. And having said that, I will only talk about one I'll jump straight away into some examples on how smart technology or smart applications of this technology were used, not of course, this global what we call a global mapping of applications of smart technologies that were used during COVID-19. What app here, if you look at the 4 columns or 4 rows of in the green boxes, are big data, artificial intelligence, mobile internet, and cloud computing. Again, of course, there's more, but let's keep it simple, because if you look at the circular diagram, there's a lot, and those are all interconnected into various sectors of our work, of our life. Yeah. So, for example, in big data, many government, many organizations, institutes have been using big data for data display of latest situation, for analysis and forecasting of COVID, of the pandemic, the spreading of the pandemic, to help make evidence-based decisions, profile information, only on the collection and analysis of big data, which is being, which later need to be processed through artificial intelligence, and artificial intelligence have were applied to improve quality of analysis and forecasting, intelligent medical services, and also to help contact tracing, which is very common nowadays. Yeah, and one of the most interesting and the most smart of the smartest is mobile internet. I mean, everyone owns a mobile phone, which is a smartphone that allows for telemedicine services, contact tracing again, before it reached to the data collection and data analysis through artificial intelligence. It originated, the data collected through mobile internet. So contact tracing would not happen without mobile internet. Yeah. Online education was severely disrupted, but thanks to mobile internet, it is still ongoing, of course, with some hiccups and some challenges. It allows remote working. It allows online entertainment. Entertainment is very important. It is not a secondary or tertiary sector. If not, people will get crazy. Online entertainment is made possible through mobile internet. And of course, contactless delivery. This is everyone's favorite. Your Grab food, your Food Panda, your Uber, and those kind of thing is made possible by this smart application. And of course, cloud computing, where we can work almost everywhere, anytime. Cloud computing also allows the health sector to quickly develop the vaccines and also the vaccination plan, which is unprecedented. A vaccine that is developed within a time frame of 1 year is one achievement of mankind. Yeah, and cloud computing also allows for more efficient logistics services, all this online ordering and so on. So that's how important and great these smart technologies have assisted our life. And the great news is that we are already using it. So in the context of disaster, natural hazards natural hazards induced disaster, such as earthquakes, tsunami, landslide, volcanic eruption, So there are also application of smart technologies. So in the context of disaster preparedness, humans are now able to do more accurate and faster flood risk assessment or any type of risk assessment. We are now able to create and simulate more scenarios for evacuation, for contingency plan in disaster situation. We can make a more accurate asset and population vulnerability assessment to understand the risk level of a particular area, of a particular community. And it also allows us to do population vulnerability assessment. So these are not available. Let's say we take an example 15, 16 years ago, when the world was shocked by the Indian Ocean tsunami that hit Aceh, Thailand, and a few other countries very severely. So thanks to smart technology, these things are all available. Similarly, it is also applicable in the situation of in the phase of disaster recovery, yeah, where agencies, government agencies, non-government agencies, academics, and so on, can monitor reconstruction, can monitor fire spreading and fire damage assessment, can evaluate land degradation, can monitor and understand the scenario or the phenomena of urban sprawl, which eventually will lead to more risk and so on. So these are all, again, are made possible due to smart technology. And all of those, though they sound high-tech, but the fact that everyone has a phone on their hand or some sort of a smart device on their hand is due to this power of exponential growth on smart technology. The world is getting digitalized. We no longer do things manually, so that allows things to be captured, stored, shared, analyzed digitally. It's very deceptive. It's very fast. I remembered, I read somewhere Bill Gates himself mentioned that no one in the world will need more than 64K of computer speed. He mentioned that in 1980, and you imagine what are the speed of a computer today. It's very disruptive. It disrupts many industries, many sectors, including education as well. And because of dematerialization of things, I don't believe that there are many people who when they go out, they will bring a phone, a camera, and a computer all in one go, because everything is available in one smart device. Yeah, and because of that, because of dematerialization, access to devices are made more easier, because it keeps on getting cheaper and cheaper, and that democratize people's access to this kind of technology and devices. Anyhow, we need to also always be remembered that there are certain portions, certain community that have very limited or no access to this sort of devices and smart technology. So with the principle of leaving no one behind, while we are enjoying the availability of this smart technology, let's not forget there are a certain section, a segment of the community which have no access. So as a result of those access towards smart technology, and there are more and more smart solutions across all sectors of the society. And when I say across all sectors, it means it starts from the government right until the community level. Yeah, be it in the area of smart mobility, smart safety and security, energy, waterways, lifestyle, yeah, health and medicine, education, like what we are doing at the moment, yeah, smart financing, tourism and leisure, retail and logistics, manufacturing, construction, smart government as the whole governance. So all of this are the enablers are enabled through disruptive technology and innovation. While the goals are quite clear, yeah. If you look at the horizontal green bar, the goals, which are not, of course, not limited to these three, but economic growth, quality of life, ecological footprint, sustainability, and so on. So those are very clear goals, but they still come with challenges, yeah. And these are the challenges that we, especially the young talents, the young brains out there, plus the scientists in universities, are required to be aware, to understand, and to be able to offer innovative solutions in overcoming these challenges. Yeah. And what I mean here is that I simulate a very basic model, a very basic smart technology-driven framework for community resilience. And they involve at the outer ring, the gray ring, who are the stakeholders, who are the actors. So they need to include government, of course, as the whole, as the custodian, as the enablers, the business sector, the business actors, the corporations, the rich industry, and so on. The knowledge partners, universities, schools, research institutions, and most important are the citizens, people like you and me, to reach those goals and to overcome those challenges. So this is a very basic framework that I think each and one of us can take this and develop what are our contribution, be it in the data part, be it in the technological part, be it in the skills and competency, and so on. Yeah. So what do we need? What the world and humankind need is a comprehensive but easy to manage solution. So the column in blue shows more or less what the Internet of Things platforms is today. Yeah, it existed. Everyone has access to it, but it is still very fragmented. So the industrial player, let's say in the sector of smart electricity, they have their own protocol, they have their own IoT platforms, and they have their own ways of a form of analytics. People in security have a different protocol. It exists, but they are still fragmented. What we need in the future, and the future could be next month, the future could be next year, is to have a more comprehensive, interconnected platform, consolidated platform. Same objective, same input of data, but with a consolidated IoT platform, which can be shared across most sectors. Okay, so that is theoretically what the IoT platforms in the future will look like. And we can start simple. Well, while I'm saying that it is simple, the diagram does look a bit complex, but just to summarize what this complex diagram is all about, we have the communication protocol, we have the infrastructure, and the infrastructure can be easily understand by having a layer of hardware, your computers, your smartphones, yeah, and then a storage infrastructure, your memory card in the smallest form, or the big data storage somewhere that belongs to a big corporation or a country. So that is the data center, and data will be meaningless if it is not analyzed to be understood and to be turned into something that is useful, usually in strategic decision making. So that is the flow or the what we need, yeah. And even though data has been, decision has been made, recommendation has been made, it will still remain useless if it is not communicated back to the community, to the users, yeah. Because we have social media, we have the traditional media, we have web services, we have all sort of IT platforms in businesses, in organizations. So those are the platforms that are required as the output for what we have captured. And so for example, if an agency can predict there will be a typhoon in the next 3 days, well, they have all the capacity to predict that. But if it is not communicated to the man on the street, to the community at the end of the village, it will still be meaningless and basically useless. So how can it work at the community level? Like I said, almost everyone owns a digital smartphone, and therefore it enables a citizen or many parts of the community to be contributor to data. So this is what I call wisdom of crowd. Crowd, even though they are large, they have their own wisdom because they can contribute a lot. And yeah, second row is saying that this is very possible because of smart digital tools which are affordable and more accessible. So for example, if you decide to use your phone just to do TikToks, well, you'll be making yourself and your friends happy. But if you decide to use it smartly and download devices or open software and learn it, which are quite easy, it will allow non-expert to be part of the contributing factor in reducing risk. Yeah. And of course, when it gets more advanced, additional tools will allow a more sophisticated and more complex information to be processed, which eventually will help to contribute understanding to the understanding of communities and the process of decision making. Yeah, so that's how that's how powerful communities are, and that's how powerful a smart community can be if they decide to use their smart technology on their palm to contribute to something better. And in this case, it's about reducing disaster risk and strengthening resilience. So, so enough about community and smart technology. We need to be remembered that globally, there are many global frameworks, and one of them is the Sendai Framework for Disaster Risk Reduction, which was signed in Sendai, Japan in 2015. Malaysia, Indonesia are all some of the 169 countries which are signatory for this framework. What we need to do is to reduce, there are 7 targets that we need to reduce, then there's 3 targets that we need to increase by 2030 and by 2020. These are very high level, but nothing high level can be achieved if at the community level it's not doing anything. And one of the contribution factor is through what I've shared before. And to go hand in hand with the Sendai framework is the overarching global sustainable development agenda. And what I'm showing here is an example on how we can have a cohesive understanding of each SDG targets, which are relevant to disaster risk reduction and management, and how they need to be used and how they can contribute and interlink with other focus sectors such as socio-economic, infrastructure, land and water, and climate change. Of course, this is very complex, but reading materials are available online. You can also contact me directly if you need to discuss more on this. But for the benefit of time, I'll just leave it as it is today. So I think this is my last slide. Thank you very much. That's my email. Please feel free to contact me. Thank you.
Okay, thank you so much, Mr. Hafiz. That is, wow, an interesting presentation indeed. We here at School of Technology Management, obviously, we are trying to do our part in trying to manage technology to assist in various aspects, including disaster management, which is why we have our institute here, DMI. So with our final speakers completing his presentation, that basically concludes our session for today. I would like to apologize on behalf of the organizers, due to time constraints. The Q&A session will not be done live today, but rather we will collect all your questions that you've given us throughout this particular session. Like in the first session last week, all questions will be collected from the chat and forwarded to our speakers so that they can respond in their own time. Their responses will be shared with you later. So I think that wraps it up. We started at 2:30 at 3 o'clock on the dot. Now we are at 4:30 Malaysia time on the dot. So thank you very much, everyone. On behalf of the organizers, I apologize for any weaknesses or shortcomings for this program and look forward to seeing you all again in the next webinar series. Thank you so much.
Thank you, everyone.